You're good. Today we're here with Jodi Negrin, saying that right, from Sound Children's Therapy. And we're just going to ask her a few questions about what she does and about her practice to kind of give you a better idea in case you're interested in working with her, just to see a little bit more about what she does. So Issaquah, Washington, is that how I pronounce it? Is that your area?
Yes.
Okay. I have not heard of that one before until I started researching you, and I was like, okay, make sure I say that right.
You are correct.
So can you just tell us a little bit about your services and what you guys do?
Sure. Thank you for taking the time to chat with me. We are a pediatric therapy provider clinic. I myself am a speech language pathologist by training, and I am the owner. I've been the owner since beginning of 2019 of the practice, and we have speech pathology services, occupational therapy services, physical therapy services that we offer to the pediatric population. We are in Issaquah, Washington, which is sort of in the east side of Seattle area, and we have a variety of areas around there that we pull clients and families from.
That's awesome. I love it when you find a practice that does speech, OT, and PT at one location, so that you're not driving around to like 3 separate appointments. You can kind of knock it all out in one location. That's awesome. So why are those services that you offer for parents who are new to this process and new to the autism diagnosis? Why are those services so important for their children?
I think when a child is given the diagnosis of autism, that's a very broad, it's a broad diagnosis, and within that, the child is often found to have more specific challenges that are related to what we provide. So a child with a diagnosis of autism might have some gross motor delays, and then we would refer them for physical therapy. Some might not. Many children on the autism spectrum have difficulties with communication. And within communication, we're talking social language, pragmatics, speaking, understanding. So then we would refer them to a speech pathologist, speech language pathologist, to work on those skills. Children on the autism spectrum are often found to have emotional regulation and sensory challenges, or fine motor challenges with, being able to hold open bags, close bags, hold a pen, cut, and then we would, or even with sensory feeding, and then we would refer them to an occupational therapist. So the autism diagnosis is just a very broad diagnosis, and then we are the specialties that help work on the various challenges that they may have.
Okay, that's awesome. So let's say you have a new parent that's coming to start this process with you and say, we need some evaluations. We're not exactly sure which therapies we need. What exactly does that process look like for them coming to you guys at your clinic?
Well, we understand that for many of our families, especially if the diagnosis is new, they are very overwhelmed. They're getting social media, parent groups, Google articles, just everything. And they probably feel like now they just, what do we do? Where do we go? So we try to provide a little more structure and and sort of evaluate their child, and maybe talk to the parent a little bit about what the needs are, because during the lifetime of a child who has autism, they may have various different timelines where different needs are more apparent. So maybe when they're very little, they really need to focus on speech and language, but they can walk and kick a ball and climb a slide, and so maybe they don't need physical therapy. But maybe later they might. And then maybe when they're young, they're not eating and they have all these sensory aversions to food. And then we could say, you know what, if that's a big issue right now, let's focus on that. So we try to say, let's talk to the parent, let's evaluate the child, and then help parents prioritize, because it is a marathon, it's not a sprint. And it doesn't have to be everything every day, all the time, in every area, because then that's just going to be really overwhelming for the family.
Yeah, 100%. what is your inspiration behind what got you into this business and really inspires you to keep going?
Um, well, I've always loved kids, and so I've always, as a speech pathologist, I've always only worked in the pediatric population. I've always wanted that, and it's really fulfilling to help families and see the gains that kids make. And sometimes they're very small gains, but they're there, and sometimes they're more apparent. But it's really just helping the families and the children, because that is why we do what we do.
Yeah. What would you say is probably the most challenging thing about what you guys do, and then the most rewarding?
Gosh, I would say the challenges are definitely just working with many moving targets. Once you think you have a schedule figured out, then a family might say, oh, ABA's changed their schedule, we can't come, and now we had all these back-to-back appointments worked out, and we have to kind of juggle that. So the scheduling and giving families what they want is sometimes a challenge, just because there are moving targets. COVID is a moving target.
Yeah.
And the insurance. Some parents have really great insurance, and they'll pay for services, and they'll give them unlimited visits. And some insurances are a little more challenging to work with. And we know that the child absolutely needs these services, but maybe the insurance doesn't pay for it. And so that is sometimes an obstacle.
Mm-hmm. And then what would you say is the most rewarding?
I would say the most rewarding is just knowing that we are out there helping families navigate this, and especially the families that are very new to with a diagnosis, and they're kind of navigating, where do we go, what do we do? We have other practices in the area with mental health or with ABA that we refer to, so we're happy to share resources with families and say, oh, I know this person and her practice works on this, and why don't you give them a call? So the rewarding part is just working together, and also seeing how happy it makes my therapists when they see the gains being made.
Yes.
With the kiddos.
And the parents love to see that too. I think from
Yes.
my point of view, we all love to see that.
Yes.
And last question, just what is something that you would like parents to know that are considering working with you?
I would say, I mean, our practice is fairly small. It's therapist owned, so as the owner, I get what parents, from a therapist perspective of how to help parents with navigating this. We really try and make the connection personal. We have great staff and great admin staff that we often get to know clients by name. We get to know clients, trials and tribulations, and they get to know ours, and they're so supportive of us, and we try to be supportive of them. And we really try our best, and not just to fill slots, but to make sure that the connection between the therapist and the family and the child is appropriate. We're not just saying, well, so-and-so has an opening, so here, we'd rather wait, because every therapist has a different skill set, a different personality, same with the children. So we really try and match that up based on getting to know the families and the children.
That's awesome. Well, that's all I had for you. I just really wanted parents to get a quick, couple minute glance about you and what you guys do. Thank you so much for taking the time to talk with us today. And if anybody is interested in contacting Jodi to learn more about their practice, their profile's on our site. You can click through and contact them directly. Thanks again, Jodi. Thanks for getting on here with us.
Thank you so much for interviewing me. It's a pleasure talking with you.
Oh, you too.